Good day, my dear postgraduate students. I hope you are enjoying the momentum of Glide the Slide. We are going to the next slide, and this to me is the Pandora's box, which I shall open slowly. A 23-year-old male presented with symmetrical, scaly lesions. Identify the slide and write a note on this. Be careful about it. Making a diagnosis doesn't matter at all. I would like you people to kindly write a note on this particular condition. Look at this clinically. There is bilateral, symmetrical, and there is a seborrheic or a scaly lesion that I can see. Also in the nails, there are some red and white lines which are seen. Coming to the skin per se, this is a basket woven keratin, which can be seen in non-neoplastic and inflammatory conditions, or sometimes in normal skin. The epidermis is not normal. It is showing papillomatosis, thrown into papillary folds. Also, I am able to see both nucleated, that is the parakeratosis, along with keratosis. More important will be I am finding a plane of cleavage, and the dermis is showing inflammatory infiltrate. I hope things are clear. So the condition is, it is a rare autosomal dominant disorder, genodermatosis. And please appreciate the symmetrical keratotic papules and pustules. There is some kind of incrustation that I am making out over here. Chest, back, neck, forehead, scalp, these all can be signs. Seborrheic in distribution. The first 2 decades are involved. Sometimes it can be found in a slightly older patient also. The nail changes I have shown. It is associated with ATP-A2 mutation. Look at this. Now I shall describe. Both the epidermis and the dermis show superficial inflammation. So this is a perivascular lymphocytic infiltrate that I am seeing. Corpus and rounds are the classical lesions which I shall be explaining. Intraepidermal separation that I am finding there is a plane of cleavage. Sometimes it can artifactually occur in skin slides. We should be careful. This is the parakeratosis over here. I hope you have made a diagnosis. So there is parakeratosis. It can vary from region to region. Here I am not seeing the papillomatosis, but then there is a keratosis, parakeratosis, acantholysis, most important point. There is a lysis of the epidermal cells or the interepidermal junctions, and the cells appear to be falling off. There is a large cleft-like, sometimes even bullous spaces can be seen. Corpus and rounds, these are important. Rounded keratinocytes within the superficial spiny granular layer. The upper layers I am able to see. Elongated keratinocytes. I hope these are also obvious. Let us see what these are in the next slide. They can be classical but need not be specific to the Darius disease. Courtesy Stockholm image. Suprabasal acantholysis and clefting can be there. There can be projections or villi. Extensive autolysis and superadded bacterial and fungal infections are probable. This is the slide that I would like you people to kindly appreciate. Elongated keratinocytes. Look at this one. This is appearing almost like a smooth muscle to me. I would be tempted to call it a smooth muscle metaplasia. So there is an elongation of the keratinocytes. Rounded cells, keratinocytes. So there is a peripheral rim of clearance. And also I will be able to make out the eosinophilic cytoplasm in many of the cells. Suprabasal cleavage, that is seen. Acantholysis. What more do you people want? And thanks to this particular reference for the wonderful slide and their imagination. This can be gone to for patterns in dermatology. The SAFE Medical College is also in. This is the papillomatosis that we have been saying. And this is the classical church spire appearance, which is simulative of this. In fact, your Lever and other textbooks will be mentioning church spire appearance in this. Dermal inflammation is all additional point. So these are the references. I would like you people to kindly go through this, and these are the variants of this particular disorder. Comedonal, bullous, acrokeratosis verruciformis. The differential diagnosis can be Haley-Haley disease, which we shall see later. So the diagnosis is these: Darier's disease or Darier-White disease. Thank you.